She looks normal. She laughs at your jokes. She's into you. You think, she's clean? I'm good. But you don't know what's inside her. You don't see the virus that's been hiding in her body, the one that doesn't give her symptoms, until it finds its way into yours. This is not about blame. This is not about fear. This is about truth. About the STIs men aren't being told about, the ones that hide in women and come for you. We're talking HPV, yeast, chlamydia, herpes, and more. And we're going to show you how to spot them, stop them, and save yourself before it's too late. Hidden. STI secrets in women. What men need to know. Watch until the end. Your health depends on it. So if you've never been tested, if you think you're safe because you feel fine, hit that like, subscribe, and share this with every guy you care about, because what you don't know can still hurt you. The enemy you never saw. HPV, the silent invader. Let's set the scene. You meet this girl. She's beautiful, clean polished. She works out drinks, smoothies, posts sunrise yoga on her story. You hook up. No red flags, no weird smells, no visible bumps. Nothing. 3 months later, you feel a sore spot in your throat. It hurts to swallow. You figure, allergies may be dry air, but it doesn't go away. And in the back of your mind, there's a whisper. Could it be something I caught? That's how HPV starts for a lot of guys. Not with a bang, but a whisper, or often with nothing at all. HPV, not just a woman thing. HPV, human papillomavirus, is the most common sexually transmitted infection in the world, and yet most men think it's a women's health issue. Well, because doctors talk about HPV and cervical cancer in women, pap smears, abnormal cells vaccines for teenage girls. But here's the truth. HPV affects men too, and it can mess you up just as badly. The incubation period, when you feel nothing at all. HPV doesn't knock on your door and say, "Hi, I'm here." After infection, the virus can sit quietly in your body for weeks, months, even years. It enters your system through skin-to-skin contact, usually during sex or oral sex. No condoms, higher risk. But even with condoms, HPV can sneak in from skin exposed outside the protection. During the incubation phase, no symptoms, no rash, no blisters, no discharge. You're living your life completely unaware, and while it stays quiet, it multiplies. When symptoms start, the body fights back or fails. Here's the scary part. HPV doesn't always cause symptoms. Your immune system might clear it. In fact, 90% of HPV cases go away on their own. But the 10% that stay, that's where things get dangerous. For men, HPV can lead to genital warts, usually from low-risk strains. Throat cancer, from oral sex with someone carrying high-risk HPV. Penile cancer, rare but real. Anal cancer, especially in men who have sex with men. And unlike women, there's no approved routine test for HPV in men. That's right, you might be infected and never know until it's serious. Progression, what HPV can do to a man's body. Let's break it down. 1. Genital warts, low-risk HPV types 6 and 11. Small soft growths on or around the penis, scrotum, groin, or anus. May be painless, itchy, or even unnoticed. Can grow and multiply if untreated. Not life-threatening, but emotionally distressing and contagious. 2 high-risk strains, types 16 and 18. These don't cause warts. They burrow deeper, changing the DNA of your cells. Over time, they cause cancer. Let's zoom in. Throat cancer. O starts at the back of the tongue, tonsils or throat O. Often mistaken for sore throat or tonsillitis, O progresses to pain, difficulty swallowing, weight loss. Penile cancer. O starts as a small lesion or sore that doesn't heal. May look like a pimple wart or rash. O, if ignored, spreads deeper, requiring surgery or even amputation. Diagnosis: why it's so damn hard for men. Here's the kicker. For women, Pap smears catch abnormal cells caused by HPV. HPV DNA testing is common. For men, no FDA-approved HPV test. Unless you have symptoms like warts or cancer, you won't know. Even urologists may not check unless you ask. So guys walk around infected shedding virus particles to their partners, while never realizing they're a carrier. Prevention. It's not too late. 1. Get the HPV vaccine. Brand Gardasil 9 protects against 9 strains in situ, the cancer-causing ones. Approved for men up to age 45. Most effective if given before you're sexually active, but still worth it later. I got the vaccine at 29. I wish I'd done it earlier, but knowing I can now protect future partners is 100% worth it. Carlos, 32. Chicago. 2. Use protection. But understand its limits. Condoms reduce HPV risk, but don't eliminate it. HPV lives on the skin around the genitals, anus, and groin. So unless you're wearing a hazmat suit, you're still at risk. But protection plus vaccine, not you, huge drop in risk. 3. Communicate with your partners. Normalize conversations like, have you been vaccinated? Have you ever had any STI symptoms? Can we get tested together? These convos feel weird at first, but they show maturity and often build trust. HPV is sneaky. It's common. It's silent. But it's also preventable and manageable if caught early. This isn't about fear. This is about taking control of your health, respecting your partners, and breaking the silence that keeps so many men in the dark. Key takeaways. HPV affects men too. Seriously. No symptoms, no risk. Vaccination works even in your 20s or 30s. No routine HPV test for men. You have to be proactive. Open conversations save lives and relationships. Want to protect yourself and your future? Start by knowing what's hidden inside her body and how it could be silently destroying yours. Yeast infection. UW, that's her problem, right? Yeah, that's what most guys think. But here's the real deal. If you're sexually active with women, yeast is your problem too, because even though it's more common in women, Candida albicans, the fungus that causes yeast infections, can and does infect men. And when it does, it itches, it burns, it's embarrassing, and it makes sex painful. Worse if you're not both treated. You keep passing it back and forth like some messed-up game of fungal ping-pong. Candida is a naturally occurring fungus found in the human body. It lives in the mouth, gut, skin, genitals. It's not always harmful. In fact, it's usually kept in check by the good bacteria in your body like little microbial bouncers. But when that balance is thrown off, due to antibiotic stress, poor diet, hormones, Candida can overgrow and cause an infection. In women, this often happens in the vagina, leading to vaginal yeast infections. In men, it can infect the penis. And yes, that's just as gross and painful as it sounds. Let's say you just had unprotected sex with your girlfriend. She didn't mention anything weird. Everything seemed normal. But what you didn't know, she was dealing with a mild yeast infection. Maybe no symptoms yet. Maybe just a little itch. She thought was nothing. The fungus transfers to your skin. Now it's living on you, but you don't feel anything for the first 3 to 7 days. That's the incubation period. During this time, the yeast multiplies in warm, moist areas. Under foreskin, groin folds around the base of the shaft. You don't itch yet. You don't burn. You have no idea anything's happening until the outbreak begins. Now we're in the onset stage. This usually kicks in within 7 to 10 days after exposure, but it can vary. In men, symptoms may include redness or shiny spots on the head of the penis, itchy rash, especially under the foreskin or around the glands, burning sensation when peeing or during sex, thick white substance like cottage cheese under foreskin, unpleasant smell, sort of like bread dough or sour milk. Small white patches or dry skin. It doesn't have to be full-blown to be problematic. Even mild cases can still spread the infection to your partner. Your yeast thrives in warmth, moisture, low ventilation. You know what checks all those boxes: tight underwear, sweat, synthetic fabrics, high-sugar diets. Candida loves sugar. If you've got poor hygiene or don't dry off well, it only makes things worse. And here's where it turns into a nightmare. If only one partner gets treated, but the other doesn't, it keeps coming back. She treats it. You give it back. You treat it. She gives it back. You become each other's reinfection source. That's why doctors say, treat both partners, always the good news. Yeast infections in men are treatable. Most cases don't require anything extreme. Topical antifungals, over-the-counter creams like O-clotrimazole, Lotrimin, O-miconazole. Monistat for men exists too. Apply 1 to 2 times daily for 7 to 10 days oral antifungals. In persistent or recurrent cases, your doctor may prescribe O-fluconazole, Diflucan. One pill often works. O-octu, sometimes a second pill is needed after 3 days. Lifestyle and hygiene. Keep the area clean and dry. Avoid scented soaps or harsh cleansers. Wear loose, breathable underwear, cotton, polyester. Avoid sex until both partners are symptom-free. Treat any other underlying health issues, diabetes. Antibiotic use. You can't avoid all risk, but you can do a lot to prevent infection. Smart habits. Shower after sex. Dry off completely, especially under foreskin, groin. Wear boxers or moisture-wicking underwear. Eat a diet lower in sugar and processed carbs. Avoid antibiotics unless absolutely necessary. Don't share towels or washcloths. Partner check. Ask your partner about recent symptoms. If she's got a yeast infection, wait until she's treated. Use protection, even though condoms don't block everything they help. Probiotics. Some guys take probiotics to balance their gut and genital microbiomes. More research is needed, but it's promising real story. Marcus 22. Nobody ever told me this was a thing for guys. Health class never covered this. I thought STIs were like chlamydia and herpes. Yeast infections. That's what I thought my sister got from wearing leggings all day. After 2 rounds of painful urination and itching, Marcus saw a urologist. Diagnosis: fungal balanitis, a yeast infection of the penis. He was mortified. But once treated, he and his partner both got better. Now he's one of the few guys in his friend group who talks openly about it. Just because she feels fine doesn't mean she is. And if she's carrying something silent, you'll be the one feeling it. The danger of invisible infections. Most guys think STIs come with obvious warning signs. They imagine burning pain rashes, weird smells, or dramatic symptoms. But the real threat, the infections you don't see, the ones hiding quietly in her body, the ones she doesn't even know she has until they show up. On you, chlamydia is one of the most common STIs in the U.S., especially among people under 25. And here's what's wild. Up to 75% of infected women show no symptoms at all. That means she could be walking around feeling 100% normal, living her life having sex, and unknowingly spreading an infection. Chlamydia usually takes 1 to 3 weeks to show symptoms, if any. But most women don't notice a thing. In men, symptoms may appear later or not at all. Early symptoms in men: burning while urinating, discharge from the penis, milky or yellowish, pain or swelling in one or both testicles, sore throat if oral transmission. Here's the twist. Even without symptoms, chlamydia can travel up your reproductive tract. If untreated, it can cause epididymitis, pain and swelling in the testicles, infertility, yes, really, long-term pelvic pain. increased risk of contracting HIV treatment and prevention. Antibiotics, usually azithromycin or doxycycline. 7-day course. No sex during treatment. Notify all partners from the past 60 days. Retest after 3 months. Prevent it with condoms. Regular STI testing every 6-12 months if sexually active. Communication with your partner about past infections. Nicknamed the clap gonorrhea, is another common bacterial STI, and like chlamydia, it often shows no symptoms in women. That means she might feel fine. But you won't. Incubation period. Typically 2 to 7 days, but can be longer. Symptoms may come and go. May affect genitals, throat, eyes, or rectum, depending on exposure. Symptoms in men. Thick green or yellow discharge from penis. Sharp pain during urination. Swollen or painful testicles. Rectal pain or discharge, if anal exposure. Sore throat, if oral. Without treatment, gonorrhea can cause infertility. Spread to the joints, heart, or brain. Yes. Yeah, seriously. Increase HIV transmission risk. Real story. Louis, 28. No one told me it could mess with your joints. I thought gonorrhea was just about burning pee, but I started feeling this crazy pain in my knees and wrists, like arthritis. At 28, Louis had disseminated gonococcal infection, DGI, where the bacteria enters the bloodstream. He needed IV antibiotics and physical therapy for 3 months. Treatment. Single injection of ceftriaxone. Follow-up with oral antibiotics if needed. Test again after 2 weeks. Always test for chlamydia at the same time. They often show up together. Louisa's story reminds us it's not just about sex. It's about your whole body, your knees, your immune system, your future ability to have kids. That quick hookup can have a long impact if you don't protect yourself. Trichomoniasis isn't as well known, but it's more common than you think. Caused by a protozoan parasite called Trichomonas vaginalis. It often lurks silently in women, but in men, it attacks the urethra and causes inflammation. Incubation. Period. 5 to 28 days. Some men never show symptoms, but they can still pass it on. Symptoms in men. Mild to moderate urethral irritation. Itching or burning after urination or ejaculation. Discharge from the penis. Pain inside the penis. Most guys ignore the signs because they're subtle. Just dehydration, they say. Or maybe I rubbed too hard, then their partner gets reinfected. Again. Real story, Drew 26. We kept blaming each other. My girlfriend had trach like 3 times in 1 year. She was frustrated and thought I was cheating. I was like, it's not me. Turns out I was carrying the parasite with no symptoms. I'd never been tested for it. I didn't even know it existed. Treatment. Metronidazole or tinidazole. Single high dose or 7-day course. Both partners need treatment. No alcohol during treatment causes intense vomiting. Avoid sex for a week after finishing meds. Prevention. Use condoms. Regular testing. Yes, ask for tricks specifically. Avoid douching for women. It disrupts vaginal flora. Keep communication open in relationships. Herpes is one of the most stigmatized STIs and one of the most misunderstood. There are 2 types. HSV-1, usually oral, but can infect genitals. HSV-2, primarily genital, highly contagious. And guess what? Many women with HSV-2 don't even know they have it, because their outbreaks are mild or look like shaving irritation. Incubation period. Usually 4 days, range 2 to 12 days. First outbreak is usually the worst symptoms in men. Painful blisters or ulcers on the penis, thighs, or buttocks. Fever, body aches, swollen lymph nodes, tingling or itching before blisters appear, burning when peeing. Flu-like symptoms during first outbreak. Outbreaks can recur especially during stress, illness, weakened immune system. Real story. Brad, 23. I thought it was an ingrown hair. There was this tiny bump near the base of my penis. I thought it was from shaving. 2 days later, it opened up. Then another showed up. I had no idea it was herpes. The girl I'd been seeing swore she didn't have anything. She probably didn't know. Her past outbreak had been so mild she thought it was irritation from leggings. Treatment. There's no cure, but there are antiviral meds to manage outbreaks and reduce transmission. Acyclovir, valacyclovir, Valtrex. Famciclovir. Daily suppressive therapy helps reduce shedding and flare-ups. Prevention. Avoid sex during outbreaks. Use condoms, helps but not foolproof. Open conversations about past partners. Get tested regularly. Blood tests detect HSV antibodies. STIs don't respect gender, but most men don't test, don't ask, and don't talk. Let's be different. Let's be smarter. Let's be real. Bro, how do I even get tested? What if they stick something in me? Calm down, relax, breathe. STI testing for men isn't scary. And if you're sexually active, especially with new or multiple partners, you need to be doing it. Why most guys don't get tested, and why that has to change. Let's be real for a second. When you ask a group of guys, when's the last time you got tested for an STI? The answers are usually, never. I mean, I don't feel anything. I've only been with clean girls. I always use condoms. Spoiler, no you don't. I'm not sleeping around like that. Here's the hard truth. Feeling fine does not mean you're free of infection. Some of the worst STIs, HPV, chlamydia, herpes, gonorrhea, trich, can live in your body without symptoms for weeks, months, or even years. What STI testing actually looks like. Okay, let's break the fear barrier. Self-check at home. Before you even go to a clinic, you can do a self-check. Any bumps, sores, or lesions. Burning when you pee. Any discharge, clear, white, green, yellow. Redness, itching, or irritation. Pain during sex or after ejaculation. If anything feels weird, get it checked. But even if you feel great, keep reading. Types of STI tests for men. Most clinics today make it fast, easy, and respectful. No judgment. 1. Urine test. Most common for chlamydia and gonorrhea. Pee in a cup takes 5 minutes, 0 pain. Now, blood test, used for HIV, syphilis, herpes, quick finger prick or draw, results in 1 to 5 days, still 0 pain unless you're scared of needles. 3. Swab test. Only used if you show symptoms like discharge sores or throat issues. Might swab urethra, throat, or rectum. A little uncomfortable but not horrible. STIs like yeast infections, HPV, chlamydia, herpes, trichomoniasis. These can all pass between partners. If she's been diagnosed, get tested too. Even if you don't feel anything. Even if you used protection. Let's play this out. She gets treated. You don't get tested. You have sex again. You give it back to her. She gets mad. The trust dies. You break up. Rinse repeat with the next girl. Or, you both get tested, you both get treated, you both protect each other, you both build trust, you both win. Let's flip the script. STI testing is not about fear, it's about confidence. It's not awkward, it's responsible. It's not something only players do, it's what every smart guy does. So you made it to the clinic, you're sitting in the room. Now what? Here's a script to use. Hey, I'm sexually active and just want to make sure everything's good. Can I get tested for chlamydia, gonorrhea, syphilis, HIV, and herpes? If you've had oral or anal sex, mention that too. You're not the first guy they've heard it from. You won't be the last. And guess what? Most doctors respect you more when you show up like a responsible adult. You know what makes you a man. Not how many girls you sleep with, not how smooth you talk, but how you take responsibility. How you protect the people you care about. STI testing protects her body just as much as yours. It protects the future family you might want, and it shows you're someone worth trusting. If you take nothing else from this part, remember this. You shower daily. Good hygiene. You go to the gym. Physical health. You test for STIs. Sexual health. All part of the same picture. Story. Josh, 29. I blamed my girlfriend for having herpes until I realized I was the one who gave it to her. I'd been with someone a year before I met my current girlfriend. I never had symptoms. Never got tested. She had her first outbreak and thought she got it from me. I denied it. Said she must have cheated. But when I got tested, turns out I was carrying HSV-2 all along. I was the one who gave it to her. I had just never known. She forgave me, but I had to forgive myself and learn and grow. Sometimes the worst damage we do isn't from cheating or lying, but from not knowing. We've told you what's out there. We've shown you how it hides. We've introduced you to men who've lived through it. Now let's talk solutions. What real strength looks like. It's not flexing on the gram. It's not pretending you're invincible. It's not bragging about how many girls you've been with. Real strength is taking responsibility. 4 rules to live by. 1. Learn, know the risks, know the symptoms, know what's out there. Ignorance isn't manly, it's dangerous. Test every 6 to 12 months. After every new partner. No symptoms, test anyway. 3. Treat. If you've got something, don't panic. Treat it. Most STIs are curable, all are manageable. 4. Talk, communicate with your partner. Before and after sex. Be honest, be kind, be real. You made it to the end, that already sets you apart. You now know what most men still don't, that your girl might feel fine and still carry something dangerous, that STIs don't always come with symptoms, that waiting can cost you your fertility, your health, or your future, that getting tested doesn't make you weak. It makes you a man who gives a damn about himself, about her, about doing better than the generation before him. Because silence kills. But knowledge saves lives, so learn, test, treat, talk. And when you're done watching this, be the guy who starts the conversation with someone else. Drop a comment. Real men get tested. Share this video with your boys. Like, follow, and subscribe to Sit Here with Teenagers. Because what you don't say, someone else is afraid to ask.